connecting dots from accountable care organizations to supply chain. These things are affecting so many things in the hospital, the health system, and the communities that we're trying to connect the dots what it means to our current customers. I'm not going to go into these slides. They're pretty thick. You'll have access to them. I would highly encourage you that you're an expert on ACOs at your organization. If you're not, no one else is, because it's so thick and daunting and scary a little bit that there aren't a lot of people sitting around trying to understand these. But this, I'm a little bit of an alarmist compared to Brian and Scott, but I think these are going to materially change everything. So going through here, what it's saying is by 2012, beginning of 2012, Health and Human Services for Medicare reimbursement is going to offer shared savings, which is the first time it's changing from a straight fee-for-service model, where the more things you do, the more you get paid, to start to track the quality and outcomes of what they're doing. And they'll start asking for 5-year pilot programs on up to 10 conditions, 10 different disease states that they'll start tracking. And the last point there is the FTC has given guidance that it's going to be okay to do these things and not be in violation of fair trade. So it looks like legally there's good direction, there's good guidance, there needs to be more granular guidance, but it seems like these things are sort of moving down the road. And before I get into a little bit more detail what they are and the principles, we recently interviewed the CEO of the Mayo Clinic, Dr. Robert Ness, and it was really interesting because he talks a lot about how a lot of the tenets of what ACOs are, and but doesn't necessarily give credit that it's the ACO that makes that happen. And I'll read a little bit. Mayo will be known as a trusted and affordable provider of primary and tertiary care, as well as health and wellness services to the communities it serves. Mayo's 800 physicians, 13,000 healthcare professionals in 70 communities. And I mean, I think it's a brand that speaks for itself. And he talks about, when I'm talking about ACOs, I'm talking about the material change in the way hospitals will be reimbursed. And he talks about it as the great dysfunction, the payment dysfunction in our health system. The heart of that dysfunction is the fee-for-service system, which rewards doctors for providing services or performing procedures on patients, but not necessarily keeping them well. And so he talks about how changing that is the right thing to do. Politics aside, the movement away from fee-for-service, I think, is the right thing to do. And that's his